Well, welcome back to Medical Terminology 1, and today what we're going to do is we're going to start talking about the respiratory system. And the best place to start is still going to be at the very beginning, talking about word roots and particularly suffixes. We'll follow this up with another video that has to do with vocabulary terms, which is going to be reviewing a lot of the word roots, and then we'll finally finish up with some clinical conditions using the word roots and the vocabulary terms that we'll learn in the first two videos. Let's get started. Talk about respiration. First of all, the first word I think that we need to get, the first medical term is respiration. Okay, and the word respiration is basically the mechanical process of breathing. Okay, or the exchange of gases that are in the air between the lungs and our external environment. Okay, it's this exchange of gas between the lungs and the external environment from the air, from the gases that we get in the air that we breathe in. A couple of things about the air. Okay, the air really is only about 21% oxygen. Okay, 21% oxygen is actually mostly nitrogen. It's about 90 or 79% nitrogen, and a few other small gases in very minimal amounts that we have. But this oxygen is really important, and the reason why it's important is because all the cells in the body need energy to be able to survive. There's mechanical processes going on in all the cells, and to do this, it needs energy, just like like a car needs fuel. These energies that we make comes from various fuels by things that we eat and so forth. But to burn the fuels efficiently, it really takes something else. And what it really takes something else of is oxygen. Oxygen makes these fuels burn much more efficiently and provides a lot more energy. So therefore, we have to find a way to be able to supply the tissues with oxygen so they can burn these fuels more efficiently to make more energy. Okay, and this is through the respiratory system. What happens is when we breathe in, okay, with this air, which is about 21% oxygen, this air goes down to small little air sacs. And these little air sacs are called alveoli. I'll show you what they look like in just a few minutes here. They get to these small little air sacs are called alveoli. What they find is these alveoli are surrounded and encased in what are alveolar capillaries. Now, from the cardiovascular system, we know capillaries are exchange vessels where things go back and forth through the wall of the capillary, and that's the ideal thing that we have here in these alveolar capillaries. What we find is that when the blood comes back to the heart, okay, from the body, it's used a lot of the oxygen. It's taken a lot of the oxygen out of the system, okay, and this oxygen is actually carried around in the red blood cells on a protein called hemoglobin. So when the tissues are taking the oxygen out to burn fuels to make energy in the tissues, but now this oxygen depleted blood comes back to the heart. How do we get the oxygen back in the blood? Well, what happens is the air that we breathe in is about, like I say, about 21% oxygen. Turns out that the concentration of the oxygen in the blood when it gets back to the lungs is less than that. Here's a rule. Things usually go from high concentration to low concentration. So if the concentration of the oxygen in the air is greater than the concentration of the oxygen level in the blood, we're going to find that oxygen going from the air across the wall of the alveoli, that very, very thin, paper thin, is actually thinner than paper, 2 cell layers thick maybe, okay, in some places, goes through the wall of the alveoli, through the wall of the capillary, gets in the blood and binds to the hemoglobin, simply because the level of, or the concentration of oxygen in the air we breathe is greater than the concentration of the oxygen in the blood. We also find that in the lungs, because the tissues have burned fuels, one of the waste products that we get and one of the waste gases that we get is carbon dioxide. The carbon dioxide is actually the thing that stimulates my level of breathing. As my carbon dioxide levels go up, my breathing levels go down. My respiratory rate goes down. So the idea is I have to get rid of this carbon dioxide because it's a waste gas and we don't want it accumulating in the blood. What happens is when the blood from the body that's now taken the carbon dioxide and put it into the blood comes back to the right side of the heart. And we know from the right side of the heart, as from the cardiovascular system, it goes to the lungs. When the blood gets back to the lungs, the concentration of the carbon dioxide in the blood is greater than the concentration of the carbon dioxide in the air that we breathe. So what's going to happen? Again, things go from a higher concentration to a lower concentration. The carbon dioxide from the blood is now going to go through the wall of the capillary, through the wall, very thin wall of the alveoli, get into the alveolar sacs, and we could exhale it. So what happens is what we're doing is we're doing two things at the lungs. We're taking the oxygen from the atmosphere, from the air that we breathe, which is higher concentration in the blood, and putting that in the blood. we're taking the carbon dioxide, which is in a higher concentration in the blood than it is in the atmospheric air, and puts carbon dioxide from the blood into the alveolar sacs so I can exhale it. And when this whole process that occurs in the lungs is called external respiration, which is the exchange of air and the contents, carbon dioxide and oxygen, at the lung level. Okay. What happens is then, like I mentioned before, now from the lungs that have taken the blood and replenished it with enough oxygen, where does it go? It goes to the left side of the heart. On the left side of the heart, it goes out the aorta and it goes to all the tissues of the body. And then what happens is when it gets down to the tissue level, down to the capillaries, the exchange vessels in the tissues, the oxygen now can leave the blood, go through the wall of the capillary, diffuse into the tissues, so it could be used in the cells to making energy. Okay. At the same time, carbon dioxide that's been building up in the tissues because metabolism has been producing this waste gas of carbon dioxide. Now the carbon dioxide, which is in the tissues, because it's a higher concentration there, goes into the blood. So now the blood there leaving the tissues has a higher level of carbon dioxide. Okay, so basically what occurs at the tissue, there's an exchange of the carbon dioxide getting from the tissues into the blood, and the oxygen going from the blood into the tissues at the tissue level is called internal respiration. This is the exchange of gas on the cellular or tissue level. Okay, and those are two words that are important. It sort of gives us really what happens with respiration altogether. Okay, so let's talk about some of these combining forms in the respiratory system that are okay. The first combining form that we want to talk about is adenoido. Adenoido is a combining form for adenoids. Now, we always think that, if I said how many tonsils you have, you say two, one here, one there. Yeah, you do, but you actually have three sets of tonsils. You have the tonsils that you see at the back of the throat. They're called the palatine tonsils. They sort of sit, if I was to look at where they are, they're sort of sitting in this area right in here. Okay, those are the palatine tonsils. They're at the opening of the, at the back of the mouth going towards the throat. But we also have another set of tonsils that sit here, back up here behind the nose. And those tonsils are called the adenoids, okay? These adenoids basically work the same way as the tonsils that we have in the back of the throat. So these adenoids, what the adenoids and the tonsils, the adenoids are called the pharyngeal tonsils. The tonsils that we normally see here are called the palatine tonsils. We actually have a third set of tonsils, and at the back of the tongue, they're right about here, and they're called the lingual tonsils. Well, what do the tonsils do? What the tonsils do, whether it's the adenoids, whether it's the palatine tonsils, or whether it's the lingual tonsils, when we breathe in, there's all kinds of bacteria and viruses and stuff like that that we're breathing in, whether you want to or not. What's going to happen is these tonsils are very much like lymph nodes. They try to sequester all these bacteria and the viruses that are adherent to the walls of the back of the throat and stuff like that. And what happens is they have place for a congregation of a lot of white blood cells that will come and start to destroy things. They actually drain really well to the lymph nodes. So what happens is they sort of take these bacteria and viruses before they can actually get deeper in the body, at least some of them. We're still going to get some that are deeper in the body, and we'll have to take care of them a different way. But these tonsils, what they do is they basically sequester the bacteria and the viruses and other materials like that so that they can be taken care of, they can be eliminated. Okay, so there's sort of a defense mechanism. We can get along without the tonsils. Okay, sometimes when people usually go in and they get their palatine tonsils out, they usually get their adenoids out as well. But these are the same type of tissues that we get with the typical lymph nodes. When we have a sore throat, they say, oh, you got swollen glands. Well, swollen glands are usually lymph nodes, because what happens is the bacteria and the viruses and stuff like that, they're entrapped in these tonsillar material, adenoids, pharyngeal tonsils, palatine tonsils, and lingual tonsils get drained into the lymph nodes, and their white blood cells and stuff like that could take care of them. Okay, so these adenoids are really important. When people have allergies, what happens, it causes these adenoids and the tonsils to get much larger, and that sort of like helps to, it doesn't help, but it hurts in regards to narrows down the airways. That's why sometimes people with allergies and stuff like that, they become mouth breathers, because these adenoids sometimes get so large they actually block off the back of the nasal passage. Okay, so adenoido means adenoids. That's making a long story of something that we could have probably talked about a lot less. Those are adenoids. Alveolo means alveolus. Okay, and we've talked about these alveolus before. Okay, and this is what we're taught. We've described them, but now I'm going to show you what they're really like. If we look, here's all these little bubbles. All these little bubbles are these little air sacs. And again, they're very thin. They're about one cell, and they have a membrane that sort of holds them together. Okay, and on the inside, there's also a little thin film of fluid, which I'll mention about in a second. But we have millions and millions and millions and millions and millions of these little air sacs in our lungs, and these little air sacs are called alveolus or alveoli. Okay, and they're surrounded by, over here, like we see on this part of the image, surrounded by all these capillaries. So therefore, what happens is when we look at the concentrations of carbon dioxide and concentrations of oxygen, because the oxygen concentration is greater inside these air sacs, it's going to leach all the way into the capillaries. Because the concentration of carbon dioxide in the capillaries is greater than in the alveolus, it's going to go from the capillaries into the alveolus so we can exhale it. Okay, so that's what these alveoli are. One thing I mentioned, this is just sort of offhand, I would expect you to know that, but they always talk about, when a kid is born too premature, when they have a baby who is like 30 weeks or 28 weeks or something like that, what do they always worry about? They always worry about the lungs. And the reason why they worry about the lungs is in the walls of these alveoli, there's little cells are called pneumocytes type 2 or type 2 pneumocytes. And these type 2 pneumocytes actually make this fluid called surfactant. And that surfactant lines the inside of all these little air sacs to keep the air sacs open. It's sort of like when you blow bubbles, you blow the bubbles and all the bubbles are going out with the kids and stuff like that. Why do those bubbles stay intact until you poke them or something like that? The reason why is that soap is a surfactant that actually it works with the surface tension to allow those bubbles to stay open. And the same thing happens with the surfactant that's made by these type 2 pneumocytes that are inside the walls of these alveoli. So those alveoli are the place where gas exchange occurs inside the lung, these little air sacs. Okay, so that's what that's all about. Broncho and bronchio, okay, and both of these, they could both be used for the same thing, and they basically stand for bronchial too, or bronchus, okay. Now, what's the bronchus, first of all? Well, if I look at this area, right here to down here, this up here is called the trachea. That's not it. If you actually follow down, you feel that there's a little notch on the top of your sternum right there. It's called a jugular notch. If you go just a little bit below, you're going to feel a ridge that goes side to side across the top of your chest, and that's where your second rib is. But it's also the area where the trachea divides, going one way, going to the right, and going to the left. Okay, and when it starts to branch off, these things are called bronchi. They're larger airways. So broncho and bronchio both mean bronchus, and these are larger airways. What happens is with the first branch off right here, okay, and right here would be called the primary bronchus because it's the first branch off, okay? What happens is when they start to approach and they get deeper inside the lung, this is where they actually enter the lung, somewhere about in this area. When they finally get inside the lungs, they branch off into another little area in here, okay? Another area right here, another area down in here. And this goes this way, and this goes this way. And those are called secondary bronchi. So it's, if you come down, here's the trachea coming this way. Here's a primary bronchus. The primary bronchus divides into secondary bronchi. And then what happens is then we further find from then that it branches off to smaller branches, which are called tertiary bronchi. They come off that. And these get smaller and smaller and smaller, okay? The thing that's interesting about the bronchi and the bronchus is if we look at it, it looks like there's stripes around them, okay? Let me just erase all this stuff here, okay? It looks like there's stripes around it. And they're really not stripes, but those are rings of cartilage. And what happens is the rings of cartilage hold these airways open inside the lung. If I was to take and throw a lung on a table and say, okay, take this knife and cut it, and you cut that across, again, you think, well, it's full of these little air sacs, which it is, millions of those. But as you cut it across with a knife, it feels sort of grisly. And the reason why it feels grisly is because a lot of these airways, first of all, the trachea, which is not in the lung, but the primary bronchus, the secondary bronchus, the tertiary bronchus, and it gets a little bit smaller and smaller and smaller after that, they're lined with this cartilage, and the cartilage keeps them open. So when you cut across, it feels very grisly. Okay, so that's the bronchus, and these airways don't change a whole lot in size. They're consistently in the same size simply because of the cartilage that holds them to a particular size. Okay. The next term we have is bronchiolo. Now what happens is finally, after we get down to a certain point, okay, we get down to an area where we're down at a point where the bronchi start to change, okay? Don't worry about this picture right now. The bronchi start to change. And instead of having the cartilage around the wall to keep them open, the wall starts to change and become consisting more of muscle. And the muscle is allowed to either relax and allows these smaller airways to open up, or constricts and allows those smaller airways to close. These smaller airways are called bronchioles. Now, IOLE, we know from a previous suffix, means smaller, miniature. So what happens is I get down deeper and deeper, closer to the area of the alveoli, and actually the smaller bronchioles will actually lead right directly into the alveoli, okay? But these bronchioles are able to change in size because of the muscular wall. And people with asthma, one of the things we find is either because of an allergy to something, or maybe cold or exercise, causes these muscles to go into spasm, and all of a sudden these bronchioles narrow down really small, which then causes air trapping in the lungs, wheezing, and all kinds of difficulty breathing that we see with asthma. So the bronchioles come after they get deep in the lung, very close to the area of the alveoli, and actually leading into the alveoli, and these are the very small airways. Capno means carbon dioxide. Hypercapnia means excessive or high levels of carbon dioxide. I mentioned before, possibly, that what happens is it's not so much oxygen levels that sort of direct our respiratory rate, but it's more carbon dioxide. What happens is when the carbon dioxide rate levels in the blood go up, my respiratory rate goes down. Okay. And you ever notice if somebody has, if they're hyperventilating, they're breathing hard, what do? You tell them, breathe in a paper bag. When they breathe in the paper bag, you got to remember that the exhaled air is going to have a higher concentration of, right, carbon dioxide. So when they breathe in, they're actually breathing in a higher concentration of what? Carbon dioxide. Simply because you're breathing it out and breathing it in through the same bag. As a result, it causes the blood levels of carbon dioxide to increase. That causes the respiratory rate to decrease and stops the hyperventilation. Okay. If you remember the movie Apollo 11, when the astronauts were going towards the moon, there was an explosion in the capsule. What happened was when they were there, there was no chance of going to land on the moon. They were just going to swing around the moon and come back to Earth. And the problem is they weren't as worried about the oxygen levels because they thought they had enough oxygen to make it back. What the worry was that they couldn't get rid of the carbon dioxide that was building up in the cabin. If the carbon dioxide continued to build up in the cabin, then what happened is the astronauts would all of a sudden become drowsy, they'd probably fall asleep, and then eventually stop breathing, okay, because they couldn't get the carbon dioxide out. So what they did is they had all these NASA scientists, they dumped all this garbage material and said, these are available pieces of material that can be sacrificed on the capsule, figure it out. And they actually found a way that they could scrub the carbon dioxide out of the air. But capno is that medical, as a combining form that means carbon dioxide, okay? My next combining form here is conio. Conio means dust, okay? And what does this have to do with the respiratory system? Well, it has a lot, because even though the air around us looks clear, we're inhaling all kinds of stuff. Every time you take a deep breath, you're inhaling all kinds of particles. You're inhaling small little bugs, dust mites, all kinds of different things. It's amazing what you really thought about it, what you're actually inhaling, but you're inhaling a lot of stuff. So what happens is, in certain situations, however, the air might be supersaturated with this dust. They used to clean buildings by what's called sandblasting. They'd take sand and put in a real high pressure injector, and then shoot this injector against the brick. And because of the grit of the sand, it would actually clean the brick off, so it could clean buildings and stuff like that. However, it caused the silica dust. People would breathe in the silica dust, and it would cause lung-related problems. We think about this more commonly in black lung disease, like in coal mines. When they're down in the coal mine, there's obviously a lot of carbon filaments or carbon particles that are floating in the air that people are breathing. Okay, and then therefore, if they breathe this in, the carbon then gets down in the area, deeper areas of the lungs, and actually causes significant lung disease. Okay, that's what they call a black lung, because if they took out a person with this black lung disease from coal mine, when they look at the lung on an autopsy, guess what? It's black. It's all the coal that's sort of like stained it. There have been situations where people are cleaning out old buildings, old warehouses and stuff like that. There's one like in like New Mexico or something like that that I read about in a book. That what happened was they were going to clean out this warehouse to make a manufacturing plant, and what happened is they sent all these workers in. All these workers were getting sick. They were developing this respiratory illness, trying to figure out what it was. What it was when they were in there with brooms and they were sweeping, what they realized after a while was this place had been a breeding ground for various rodents, mice and rats. And mice and rats will have droppings. And as they dusted or they swept up these droppings, they pulverized them. And all the small little pieces of these droppings were getting in the air and they were breathing them in, which is causing a significant lung disease. So sometimes to get what's called pneumoconiosis. Pneumo means lung, conio means dust, osis means condition. And that's what we see when people inhale certain levels of dust. Okay. Now the next word, combining form we should know, cyano. Cyano means blue. We know when our levels of oxygen in the blood go down, that what happens, we get this bluish tinge around our mouth and our fingernails and stuff, which is called cyanosis. Okay. Next combining form, epiglotto. Epiglotto means epiglottis. And you say, what in the world's that? Well, it says it right here. You know, here's epiglottis. What happens is at the back of the throat, here's the tongue. Okay, if I look at this image right here, let me just draw it with let me just use a pen here. Here's the tongue right here. So this is the oral cavity. You eat this big thing of food, it comes down this way. Now it has one or two ways to go. It go posterior down this way in the back, and that's going down the esophagus, which is the food tube. Okay, goes down the back. The esophagus is usually a closed, flattened tube, and the esophagus is actually stuck to the back side of the trachea. There's the muscle on the back side of the trachea is stuck to the muscle on the front side of the esophagus. Okay, so if I go posteriorly, I go down the esophagus. On the other hand, if the food comes down, or if something goes down this way, it goes through the area called the larynx or the glottis right here, and it goes down to the trachea, it goes to the lung. Well, you don't want food to go down the lungs. That's not a good place. It sort of blocks things up. What prevents food from going down the lungs and diverting it to make sure it goes down into the esophagus? That's this thing called the epiglottis. The epiglottis is a little flap. And this little flap is at the back of the tongue. You can actually see it sometimes if you push your tongue down. This little flap, when you swallow, and when you're eating something you swallow, that epiglottis, now what it'll do, it closes down. It flaps shut this way, okay, and closes off this. So as a result, the only place for food to go is down through the esophagus and not down through the trachea. And that's the epiglottis. And the epiglottis, again, goes up and down, up and down. You see some people when they sometimes choke, they're usually trying to eat and talk at the same time. You got this big guy at a restaurant, and he's making a lot of noise at the table next to you. Oh, yeah, I can do this. And he's eating this big juicy steak, and all of a sudden you're, and what happens is the epiglottis says, should I stay open? Should I stay closed? Should I open? Should I close? Should I open? Should I close? It doesn't know. He gets totally confused. I mean, epiglottis doesn't have, you know, the greatest brain in the world. But what happens is then all of a sudden that big chunk of meat gets jammed down here in the area where the vocal cords are. And so this epiglottis is basically this flap that's on the back of the throat, right, the back of the tongue, just before it goes into the vocal cords, that actually opens and closes. If it closes, it makes food go down through the esophagus. If it opens, it allows me to breathe. Okay, it's also involved in a couple other significant illnesses in kids. Sometimes in kids, little smaller kids, this epiglottis becomes inflamed. There's a certain bacteria that causes it to become inflamed. It becomes very big and actually blocks the airway, which may totally block the airway and cause death. Okay, it's called epiglottitis. And if I'm looking here, I'll get rid of all these scratches so you can actually see it. And let me explain to you where you are here. Let me orient you. Okay, here's that little uvula, that little thing that sticks down the back of the throat. Okay, we could always talk about that sometime. Here's one pillar going in the back of the throat. Here's the other pillar. You can actually see some of the tonsils sitting right here. Here's the tongue sitting right there. And that little cobra looking like thing right here, that's the epiglottis. Okay, and you can actually see it. If you don't have a gag reflex much, you can actually put your finger or something at the back of your tongue, push it down, say ah, and you might see that little epiglottis peeking up over the back of your tongue. Okay, and that's what the epiglottis is. And I'll show you a little bit more pictures when we talk about epiglottis and the vocabulary as to how it closes and stuff like that. Okay, so that's the epiglottis. Okay, epi means what? Epi means upon. Glottis is a word that means vocal cords. Okay, so the area between the vocal cords look like this. This would be anterior and this would be posterior. There's a cord here and a cord here, and that opening right in between there goes to the trachea. And what happens is the epiglottis sits right here. So if I looked and went behind this area, right down behind there, I'd see the vocal cords. Okay, so that's what we see with that. So that's the epiglottis. The next combining form that we get, let me get rid of these so you can actually see what we're talking about in this picture here, is laryngo. Laryngo means larynx or voice box. It means larynx or voice box. And that we see what's right here. So here would be the epiglottis right here. Again, here's be the back of the tongue right here, the epiglottis, and the glottis or the vocal cords is sitting right here, okay? And that's just below the area of the epiglottis, and then down this way is down into the trachea. So the laryngo means basically larynx or voice box, and where the vocal cords are. So what do the vocal cords look like? They look like this, okay? And this is what we were talking about just a minute ago, okay? And let me just get me out of the way here for a little bit. Let me just put some. The epiglottis would be sitting right here. The epiglottis is right here. In fact, you see the epiglottis better right here. Here's a vocal cord 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 here. We have two vocal cords that are attached anteriorly, and in the back they're attached. See the little bump right there, little bump right there? There's two little pieces of cartilage. You can see a little bump right there, a little bump right there. There's two little pieces of cartilage with muscles, and those muscles will cause the vocal cords to open or close, okay? In this case, the vocal cords have moved open, and now we have this opening that goes into there. What's inside there? That's the trachea, right down through that hole right there. You can actually, if you can, let me erase that. You can actually see some of the rings down there? You can actually see some of the rings. See a ring right there, and a ring right there, ring right there. And those are the little cartilage rings that we see back in there. So that's the area of the glottis, where here's the vocal cord here, vocal cord here. They're attached in the middle, in the front, okay, anteriorly, and then the back portion will swing this way or this way to open or close. Also, these muscles will make them tighter or looser, which will change also the pitch of your voice as well, okay? So how much air is going through there and the pitch of the voice, you know, will be changed by the little muscles are attached to these little two edges right here, two little bumps right there that open and close, tighten or loosen the vocal cords. And that area of the larynx of the voice box, the combining form would be laryngo. Lobo. Lobo is the next thing we should talk about here, next combining form. When we look at the lungs, okay, and we have a lung here, okay, so over here we have a right lung, here we have a left lung. What happens is the lungs are divided into lobes. So lobo is a word that means lobe, okay, and in the right lung I have three lobes, okay. I have a right upper lobe, okay, which is this area right here. I have a right middle lobe, which is this lobe right here. And I have a right lower lobe, which is this lobe right down here. Okay, that's a right lower lobe. And again, they're separated. There's a gap between them. They're called a fissure. Okay, on the left side, we basically only have two lobes. We have a left upper lobe right here, and we have a left lower lobe that sits down in here. It's a little bit different. Now, there are a couple of things that are interesting. The lungs are a little different in shape and stuff like that. If we look right here, there's a little notched out area right there. The reason why it's called a cardiac notch. Why? Because the heart sits more in this area right here. Okay, this little area that looks like a tongue right there, that's called the lingual region of the lung. So basically, lobo means lobe. Okay, and the right lung has three lobes. Left lung has two lobes. Usually, sometimes there's actually a third lobe in there, but usually not. Mostly three on the right, two on the left, okay? Sometimes people go what's called lobar pneumonia. Maybe you've heard lobar pneumonia. And lobar pneumonia, what happens is you'd find like one lobe becoming totally involved. That's usually a bacterial type of a pneumonia. When you look at an x-ray, you'll see this area is black here, but it's actually very white because it's all filled with pus and fluid and stuff like that. So lobe are basically the segments of the lung. So lobo means lobe, okay? So that's pretty simple to figure out. It's pretty easy to figure that one out. Now this word right here you should already know, okay? Mediastinum obviously means mediastinum, okay? Mediastinum. So that was a word that we had in body systems, okay? We know we have a right pleural cavity, we have a left pleural cavity, and the cavity that's in the middle, okay? Cavity that's in the middle of all this is called the mediastinum. What's in there? It's the heart's inside there, the aorta, the pulmonary arteries, pulmonary veins, the inferior and superior vena cava, the trachea, the esophagus, a bunch of nerves and other vessels. They're inside the center chamber. So that's called the mediastinum. And mediastinum means mediastinum. Everybody should know that one. That's a piece of cake. Everybody's had that one before. Naso. I don't know if I should insult your intelligence, but naso obviously means nose. It means nose. And nose is actually quite bigger than what we actually see. Okay, when we look at the nose, okay, naso, nose, you know, we see this part right here, but there's a large cavity that goes behind your nose. And again, there's adenoids are going to be sitting right back in here. Adenoids be right here. This little area right there, you see like a little hole, that's the eustachian tube. That actually goes to your middle ear to keep the pressure in front of and behind your middle ear constant. If you really want to try something, try this. Later on, go into if you have a little pen light, if if you have a little pen light, go in and then pull up your nose and look inside your nose and see what it's like. And you actually see these little shelves of tissue that are up there. You usually see this one right here, okay? It's hard to see this one right here, and the top one you really can't see unless you have a special scope. But these are called turbinates. And what happens is inside the nose, okay, inside the nose, what we find is that they increase the surface area by putting these shelves on the inside. They're underneath this bone, and they're covered with this mucous membrane. What it does is as I breathe in through my nose, okay, because there's an increased surface area, that area is full of blood, and what happens in the tissue, and as a result, it warms the air. Also, what happens, there's small little hairs in there that trap a lot of particles, okay? Also, because these mucous membranes make mucus, what happens is it causes a lot of those particles to stick to the wall. There, when people do their nose mining and stuff like that, big crunchy things out, that's all the mucus with all the garbage that they're inhaling that comes through there. So the nose is actually quite large inside. Smelling up in here is called the olfactory bulb. Well, we have all of our nasal sensory smell fibers actually come through a small little bone right here, and they're usually the strongest right up here at the top of the nose. So the nose is actually quite large. Okay, so naso means nose, okay. Ortho. Now, ortho we've had before. Ortho means straight. You say, what does straight have to do with this? Sometimes people with certain pulmonary or cardiovascular diseases have what's called orthopnea. Now, P-N-E-A, as you know from before, and we'll mention before, means breathing. Okay. Orthopnea means that what happens is some people, because they have a certain, like if they have emphysema or chronic pulmonary or chronic bronchitis, or which is basically COPD with that or the emphysema, what happens is sometimes they can't sleep flat. They have to sleep with their head up. People who are exceptionally obese, they have to sleep with their head up. People who have heart failure, they have to sleep with their head up because they can't sleep flat. They can't sleep straight, and they call that orthopnea. So ortho means straight, okay? The next combining form, oxo. Oxo obviously means oxygen. It doesn't take a rocket scientist to figure that one out. Pectoral means chest. The muscles on the front of the chest are called the pectoralis major, these large muscles that are in front of the chest. When you have a fish, they have a pectoral fin that sits on the front. So pectoral means chest, okay? Pharyngo means pharynx or throat, okay? Means pharynx or throat. Now, if I'm looking at this picture, and I'll get rid of my scratches so you can see it, there's actually three parts to my throat, okay? The upper part that we see up in here is called the nasopharynx. Now, this is behind the nose. The adenoids, again, are sitting right in this area, in that little pocket right in there. That would be right in here, would be that little tube that goes to the ear, that eustachian tube, okay? Or sometimes called the pharyngotympanic tube. But anyway, this is called the nasopharynx, the air up in there, because it's the part of the throat behind the nose, okay? The part down here is called the oropharynx, okay? Which is just below that, and that's the area behind the mouth. Oral means mouth. And the part down here is called the laryngopharynx because that's behind the area of the larynx, which is right there. So that's basically the pharynx or pharyngo means throat or pharynx, nasopharynx, oropharynx, and laryngopharynx, okay? Phono, okay, is my next combining form, okay? Phono. And phono means sound or speech, okay? What do you call somebody on? A telephone, ooh, sound. What did you used to play records on? If you still have records, I still have records in my room over there. What do you play? A phonograph. Okay. When you were first learning how to read, what did you learn? Phonetics. So phono means sound or speech. So remember telephone, phonograph, phonetics, and that's going to be an easy key as to where you're at, okay, in regards to what phono means. The next combining form I have is phreno, okay. Phreno means diaphragm, Now, if you look down at this image right here, we've talked about the diaphragm in multiple situations before. The diaphragm we talked about as that division between the thoracic cavity, thoracic cavity on the top, and the abdominal pelvic cavity on the bottom, but it's more than that. What happens, the diaphragm is a muscle. And the diaphragm, if we start to look at it, up in here it says C3, C4, C5. And what happens is when the spinal cord comes down through the area of the vertebrae right here, there's a branch that comes out at C3, cervical third, fourth cervical and fifth cervical, and they come together. And that nerve is called the phrenic nerve, okay? The phreno means diaphragm. The nerve goes through the mediastinum, covers over the top of the heart, and implants itself into the area of the diaphragm. So it comes down this way, or the top of the heart and plants itself. What happens, and the reason why the diaphragm is important, I mentioned that, you know, how we bring air in, that how we exchange with respiration. What happens is, what is ventilation? Ventilation is much more mechanical. What really happens with ventilation is when the phrenic nerve contracts, the muscle of the diaphragm contracts, and instead of the diaphragm muscle being like this, like a dome like we see here, it flattens out. Okay, so I have my chest cavity right here. What happens is, if I have a certain volume here, and I drop my diaphragm like that, what does that do to the volume inside the chest? It increases it. And what it does, it creates like a suction, okay? And so as a result, what happens is, since there's only one way in, through the nose and the mouth, to go down the trachea to then go to the lungs, what happens is it actually draws the air in. So when our phrenic nerve contracts, it causes the diaphragm to go down. It increases the superior inferior dimension of the chest. That's also aided by the fact that between each ribs there's a muscle. It's called the external intercostal, between each of the ribs. What happens is, the same time the diaphragm goes down, the external intercostal muscles fire and they pull the ribs up. So what happens is, it also increases the width of the chest. So the entire volume of the thoracic cavity is significantly increased, okay? And there's a thing that's called Boyle's law, and you have to remember this, but Boyle's law says volume is inversely proportional to pressure, okay? So what happens is, as the volume goes up, the pressure goes down. So as a result, we almost have like a more of a negative pressure inside the thorax as compared to the pressure on the outside. And where do things go? From higher pressure or a higher concentration to a lower concentration. Therefore, what happens is, air then goes through the nose and through the mouth, goes through the trachea, through the bronchi, and then fills the lungs. And that's how we breathe. We exhale, that's inhalation. We exhale by just relaxing the diaphragm and letting the external intercostals relax. So therefore, what happens is, now that the chest comes back down this way, diaphragm comes back so where it's supposed to be, and we breathe out. Okay, so that phreno means diaphragm, It's a really important word. Okay, so phreno, diaphragm. Next word is pleuro. Now this is a word that we had before, which you should know about pretty well. And that's because what happens is, we know that the lung in the pleural cavity is covered by a membrane, and that membrane in there is called the pleura, okay? And that pleura, like we talked about before, is a double layered membrane. If we look right here, we have a blue layer that's on the surface of the lung. It starts here, comes up this way, covers the lung this way, all the way down here, comes this way, comes back way to this way. And when it gets to that, it turns back on itself. And when it turns back on itself, comes back this way, covers the diaphragm, the inside of the chest wall, comes up this way, back here, and then meets here, and it turns back on itself. Okay, you can actually see it right here. Here's this right here. That's that, and that we know that pleura that lines the inside of the chest is called the parietal pleura, and the pleura that covers the outside of the lung is called the visceral pleura, and between the two is what's called the pleural space. Now this area in here is not air. It's filled with a little bit of fluid. Okay, it's filled with a little bit of fluid, and that fluid allows when the diameter of the chest. Let me get my picture back up there so you can actually see where. Get up there. Don't go away. When the diameter of the chest increases this way, and the volume increases, and it decreases the pressure inside, and it draws things in. The lungs, because of this pleural space, it's almost like a suction. So when the ribs go up and out, and the thoracic cavity goes out, so does the visceral pleura. That's sort of like, I can't say stuck to, but is attracted to the parietal pleura. You know, if you take like a glass slide, you know, a microscope slide, and you put a drop of water on it, and then you put another slide on top, it's hard to get that slide on the top off. It's not like there's glue. You can actually slide them back and forth and twist them around, but it's hard to pull one off. And that's the same thing happens because I have a little bit of fluid in this pleural space that sort of keeps that visceral pleura against the parietal pleura. But since they're not firmly attached, it allows it to slide. Okay, and that's what the pleura is all about. Okay, so that's pleura. Last combining form that I have on this page is neo, and neo means breathing, okay? Which is basically nea, P-N-E-A, means breathing as a suffix. So that should be an easy one to remember, okay? We have a couple more combining forms here that we have to finish. Pneumo and pneumano both mean air or lungs. Piece of cake, okay? Pneumono both mean air or lungs, okay? Rhino means nose. Now that's one we had before. Rhinoplasty, nose job. Okay, so rhino means nose. Next combining form is sinuso, means sinus. Now what's a sinus, okay? Now if I look over here on this picture right here, see these little pinky things right there? Pink there, pink there, pink there, over there, okay? Those are sinuses. And what a sinus really is when the bone comes down, okay, bone comes down, let me do it with a little bit bigger mark. Bone comes down, and eventually at some places it separates, then meets again, okay? So there's a little gap, there's a little hole, you know, it could be large, and that's where it's open there, 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 and this little thing is called a sinus, and its sinus is lined with the same membrane or the same tissue that lines the inside of the nose with a mucous membrane, and it actually has a channel that drains, or a tunnel that drains into the nose. So what happens? These sinuses make mucus. The mucus then drains through a channel that actually goes and drains into the nose, and we could drain it out our nose, part of the nasal drainage that we get through these areas, okay? And that's what the sinus is. When people have a sinus infection, what happens is the problem with the sinus infection is that tube that drains the sinus gets narrowed down. What happens, we have swelling with a cold upper respiratory infection, and this tube gets narrowed down or clogged off. And as a result, the mucus builds and builds and builds and builds and builds and keeps on building until it builds so much. There's so much pressure inside there. That's why you feel that pressure-like pain when you have a sinus infection. That's pressure pain because why? Because it can't drain out. All that mucus is building up and there's all dressed up, no place to go. Can't get out through that channel that goes in, that drains into the nose. Okay, so and then so what they do is they give a decongestant. It opens up the channels again, allow that drainage to occur, and the pain goes away. Okay, I'll give you a little parlor trick. You know, besides looking at your epiglottis, if you have fun, if you're a masochist, you try this. If you take a pen light, okay, and go into a dark room, and you take that pen light and you push it up underneath your eye, like right here, okay? So like on the nasal side, right up underneath that little shelf of bone right there, push it up right there, turn the pen light on, and what will happen is your forehead will glow. That area will glow. You'll see it glowing right there. And that's basically because inside that sinus, this is called the frontal sinus, by the way, inside that frontal sinus is mostly air. If it's not air, it's a little mucus, which is definitely a lot less dense than bone. So as a result, it's called transillumination, where I'm able to actually see the sinuses by taking that pen line. You can actually see it. You'll see little lobes, you'll see like little bubbles, like there, little like lumps of stuff. It's actually sort of cool. You can't see these too much. This one you can, but you have to do it a little bit different. With this is called the maxillary sinus, and that's right here. You know, when people have a sinus infection that's a pain below the eyes, that's the maxillary sinus. And this one drains bad, because if you think about it, if everything is draining down to the target spot right here, the frontal sinus is draining down, these are draining, this would actually drain sideways or up a little bit, which doesn't go very well. Fluid doesn't go uphill very much. So that makes these maxillary sinuses don't drain nearly as well. But if you want to do that same parlor trick, take a pen light and stick it like this. Stick it right over your cheek, right next to your nose like this, and point it down, and then open your mouth and look at the roof of your mouth. The roof of your mouth will glow. Why? Because again, that transillumination, you're able to see through that area because this is all full, usually of air. And therefore, it allows that light to be transmitted through that. So those are called sinuses, okay? Sinus, okay? Next word we have here is spiro. Spiro means breathing. When they do a breathing test, it's called spirometry. You know, they have you breathe in the thing, okay, take a deep breath, okay, blow out as hard as you can, keep going, keep going, keep going, keep going, until you feel like you're about ready to implode, you know? And then that's measuring your vital, your breathing capacities, okay? There's multiple vital capacity, tidal volume, all kinds of different things like that. But basically, spiro means breathing. Tello is sort of a weird word in here in regards to combining form. It means complete, okay? And where this comes into the pulmonary respiratory section is, let's look back at our lungs, okay? Our lungs, we have different lobes. We have different segments of those lobes. Our bronchopulmonary segments, you don't have to remember that. But if each lobe is broken into smaller little segments. If a segment is not used, what we find is it collapses like a sponge. Okay, if you take a sponge and stick it on a table, the sponge might be this big because it has a lot of sponge material, but it has a lot of air holes. If I take that same sponge and push down on it, all of a sudden the sponge is this big. And that's what happens sometimes in the lungs in an area where I'm not being used. Okay, it's not being full of air. Okay, and this is called atelectasis. A means without, telo means complete, ectasis means stretching or dilation. Okay, and it's not a good thing because what happens is people with atelectasis are more likely to develop pneumonias in that area and stuff like that. People when they after surgery and they don't want to take deep breaths, they actually do respiratory therapy. They have them blow in bottles and take ping pong balls and blow into a tube and make the ping pong balls go up and all kinds of stuff. They're forcing them to breathe because if they don't breathe and they don't expand their lungs, they end up with this atelectasis. And as a result, then it results in pneumonia, and then you have all kinds of worse problems after that. But telo is a combining form that means complete. The next combining form that I have here is thoraco, or thora means chest. Okay, that was an old one. That's a piece of cake. Tonsillo. Now, tonsillo we talked about before. That means tonsils. Okay, and again, if we look at this image of the throat, this diagram of the throat, we actually see what we're talking about. Okay. And we have, again, the three different sets of tonsils that we have. We have the pharyngeal tonsils, which are also called, again, the adenoids. Okay. We have our palatine tonsils, which are the ones that we usually think about. Here's the palatine tonsil on the side. And at the back of the throat, we have these things called lingual tonsils. Lingual tonsils. If you actually take your finger, if you don't have a gag reflex very well, and you feel the back of your throat, it's going to feel very lumpy, bumpy. And what you're actually feeling is you're feeling some of the area of the lingual tonsil at the back. Okay? So tonsillo means tonsils. Last word we have is tracheo. Okay? Tracheo. And tracheo obviously means trachea. So trachea, that's what we're talking about here. Okay, let me erase all this other stuff here. Trachea is that windpipe. Okay, and the windpipe is actually a lot shorter than people actually give it credit for. If you feel right here in your neck, okay, you'll feel that little Adam's apple, that little cartilage, and that area up there is called the thyroid cartilage. Okay, this area right here is the thyroid cartilage, and you can feel that. In males, it's much more prominent. It sticks out a lot more. In females, it's a lot flatter. The angle is different, which also results in the difference in the pitch of voice and stuff like that. Then what happens, there's another ring that's right below that, which is called the cricoid cartilage. Okay, so we have the thyroid cartilage up here, cricoid cartilage, and there's a little gap between, okay? Right there between, it's called the cricothyroid membrane. Sometimes if people have, the vocal cords, by the way, are sitting right about here. Right down at the bottom, right there. Oh, excuse me. That's not correct. Okay, I'm looking at the wrong spot. The vocal cords are sitting right there, just above that area of the cricoid cartilage or cricothyroid membrane. Because what happens is sometimes if people get something that's caught right there in the vocal cords, they can actually go and they take some type of a tube and stick it right in through there, and it's below the level of the vocal cords where the piece of meat or whatever is caught, and they can start to breathe again. But this is the trachea from this point down to here, okay? And this is where the cartilage rings are around. And if I looked at the trachea, it looks like this. It's pretty much open, okay? And then on the back side of the trachea, I have the esophagus, which is basically a flattened tube that looks like that. If I look at that cartilage on the trachea only goes about 2/3 of the way around. It goes about like this, okay? It doesn't go all the way around. And the reason why, again, like at the back surface right here, the trachea is attached to the esophagus in the back. You can't have that cartilage that would obstruct back in here. So as a result, the cartilage of the trachea only goes about 2/3 of the way around, okay? What happens is the trachea comes down to this point right here. And at that point right there, okay, it branches off. And we talked about how it goes to the primary bronchus, primary bronchus going one way and the primary bronchus going the other way. And the trachea right here has this upside down V. The upside down V area is called the carina. C-A-R-I-N-A. Carina means keel. And keel means the bottom of a boat. If I turn the boat upside down, rowboat, turn it upside down, you see it comes to a point at the bottom. That point at the bottom would be called the keel. And because it's like, that's the bottom of a boat, like the keel right there. This is really important because this area right here, in this carina area, is where we have special cells that initiate our cough reflex. When things get down deeper in my lungs, they get worked their way up by these things called cilia up until this area of the carina where the cough reflex cells are that stimulates the cough reflex. You cough that puppy out, okay? So it causes you to create a muscular contraction that will actually force that material up the trachea and out, okay? So that's about a little bit about the trachea. And again, the trachea, if you think about it, if you feel right here, there's a little notch at the top of your sternum, which is called the jugular notch right here. At the top, remember the manubrium? If you go down at the manubrium, where the manubrium meets the body, there's actually a piece of ridge that goes from side to side. That's the area of the second rib, and that's about the area where this carina is. Very close to that area is where that second rib and where that little ridge is called the sternal angle. Okay, but that's have a couple of suffixes that we should talk about here. Okay, emia. This is one that we had before. Okay, this is a piece of cake. Emia means, whoops, why should it come out black? Okay, emia means blood. Okay, hypoxemia. Hypo, low, oxygen, emia. When people have low blood oxygen, it's called hypoxemia. I know I have my little watch, my little sport watch here, and if I tap here, let's see what I got here. Steps, miles, kilocalories, there's my heart rate, blood pressure, blood oxygen. So let me look at my blood oxygen. Takes a couple of testing. 1, 2, 3, testing. Takes a couple seconds. It's measuring my blood oxygen level. Blood oxygen level. It's coming up. It will. 97%. Okay, which is good. Okay, should be above 90, 96, 95. Okay, and that's good. So if it's low, if my blood oxygen level, I test it there and it was like 89, I have hypoxemia, low oxygen in the blood. Okay, osmia. Osmia is a word, or a suffix that means smell. Okay, this has come into common terms now, simply because one of the signs that they find, or one of the actually probably more symptoms are things that people describe to you. Signs are things that you can actually feel or see. But if somebody comes in and says, I can't smell anymore, it's called anosmia, because an means without, osmia means smell. So one of the things we've seen in COVID-19 is anosmia. Okay, they lose their sense of smell. Okay, and it seems to be a relatively common occurrence. So osmia means smell. Pnea was an old one, which means breathing. Apnea, absence of breathing. Hyperpnea, deep breathing. Tachypnea, rapid breathing. Eupnea, normal breathing. So pnea means breathing. Ptysis means spitting. Okay, when somebody spits up blood, if somebody has like a lung tumor, or if they have tuberculosis, sometimes you'll see them, they'll cough up blood. Okay, and basically that's called hemoptysis, because hemo means blood, ptysis means spitting. Okay, tuberculosis is if you look at some of these old movies, and they talk about like Elizabethan and stuff like times and all kinds of stuff like that. What happens is you see a guy that's there with a handkerchief, he's coughing, all of a sudden there's blood on it. All of a sudden he has the consumption. Consumption was something that they used as a term meaning tuberculosis. They thought it was something in the air. They'd put them into sanitariums, which were basically places like in the mountains or places with clean air, and that was cure them. And some people were okay. Some people, they still died. They did that. Tuberculosis is a really nasty disease. It's basically a mycobacterium that we inhale in. Okay, and what happens when people cough or sneeze, this mycobacterium gets in the air, we breathe it in, and as a result, it goes to the lungs, and it says, you know what, I got time. I'm in no rush. It sits there for a while and sort of brews. And it builds a little capsule around itself, and it sort of like walls itself off. And sometimes people get like a little cold or like a little flu symptoms for a while, but then they get better. And then what happens is they may go on with nothing else and nothing else and nothing else. And then maybe sometime in the future, when their immune system is bad, all of a sudden they start to get more chest pain, not so much chest pain, more shortness of breath, and eventually maybe even some hemoptysis. Okay, and all of a sudden it becomes activated. That's why people, when they get the TB test, if it comes back positive, it doesn't mean that they have active TB. It means that they've been exposed to it, and the TB is probably sitting somewhere in their lungs. So these people may undergo treatment. The problem with TB right now is that we'll talk a little bit more about TB when we talk about conditions. The problem with TB now is there are some strains of TB that are almost impossible to cure. There are some areas and some places in Africa when people have certain types of TB, guess what? It's a death sentence. There's no way to treat them. TB is, first of all, very hard to treat. Usually requires a minimum of 2 and usually 3 different antibiotics that you take for 4 to 6 months sometimes to kill it. And the reason why is the mycobacterium has this waxy coat that almost resists antibiotics from destroying it. So it's a tough. We'll talk a little bit more about this when we talk about some conditions in a third video. So ptysis means spitting. Rhea means drainage or discharge. Rhinorrhea, that's one word that we had before. Nasal drainage. Thorax obviously means chest, and that's something that we had before. Okay. So anyway, what we've gone through this video is talk about some of the combining forms. We've actually built a pretty good foundation for a lot of the vocabulary words. So when we get to the vocabulary video next, you'll be able to pretty much follow it pretty well if you know these combining forms, because a lot of these things are going to come up again. Okay, I'll discuss them again, maybe a little bit more in a little bit more depth. Okay, so I'd make sure you know these combining forms really well. And most of the suffixes we've had before, so it's really not much of a problem. Okay, so until next time, stay safe, stay healthy, and I guess keep on breathing, because it's the respiratory system. That's a pretty good thing to do. Okay.